Adrenal crisis, also known as Addisonian crisis and acute adrenal insufficiency, is a medical emergency and potentially life-threatening situation requiring immediate emergency treatment. It is a constellation of symptoms that indicate severe adrenal insufficiency caused by insufficient levels of the hormone cortisol. This may be the result of either previously undiagnosed or untreated Addison's disease, a disease process suddenly affecting adrenal function, such as bleeding from the adrenal glands in Waterhouse-Friderichsen syndrome, suddenly stopping intake of glucocorticoids, or an intercurrent problem, e.g., infection, trauma. In fact, any form of physical or mental stress. In someone known to have Addison's disease or congenital adrenal hyperplasia, CAH. Signs and symptoms. Characteristic symptoms are sudden penetrating pain in the legs, lower back or abdomen, confusion, psychosis, slurred speech, severe lethargy, convulsions, fever, hyperkalemia, elevated potassium level in the blood, hypercalcemia, elevated calcium level in the blood. The cause of hypercalcemia is a combination of increased calcium input into the extracellular space and reduced calcium removal by the kidney. This last caused by decreased glomerular filtration and increased tubular calcium reabsorption. Both renal factors are secondary to volume depletion and, in fact, improve rapidly during rehydration with saline infusion. Hypoglycemia, reduced level of blood glucose. Hyponatremia, low sodium level in the blood. Hypotension, low blood pressure. Hypothyroid, low T4 level. Severe vomiting and diarrhea, resulting in dehydration. Syncope, loss of consciousness and ability to stand. Causes. Addisonian crisis is caused by deficiency of cortisol. Cortisol deficiency may be due to Addison's disease, congenital adrenal hyperplasia, CAH, corticosteroid biosynthetic enzyme defects or pituitary disorders, such as Sheehan's syndrome, pituitary adenoma, hypopituitarism, inactive or underactive pituitary, causing failure to activate the adrenal glands. Diagnosis. Various investigations aid the diagnosis. ACTH, concentropin, stimulation test, cortisol level, to assess the level of glucocorticoids, fasting blood sugar, serum potassium, to assess the level of mineralocorticoids, serum sodium. Treatment. Acute adrenal insufficiency is a medical emergency and needs to be treated with injectable hydrocortisone and fluid support. Prevention. Adrenal crisis is triggered by physiological stress, such as trauma. Activities that have an elevated risk of trauma are best avoided. Treatment must be given within 2 hours of trauma and consequently it is advisable to carry injectable hydrocortisone in remote areas. Epidemiology. Hana et al. Investigated the frequency, causes and risk factors for adrenal crisis in patients with chronic adrenal insufficiency. Anani et al. S. landmark 2002 study found a very high rate of relative adrenal insufficiency among the enrolled patients with septic shock. Acute adrenal crisis on PubMed Health. Adrenal crisis on patient info. Catherine White. The 28th of July 2004. What to do in an emergency Addisonian crisis. Addison's disease self-help group. ADSHG. Addisonian crisis on right diagnosis. Com.